Welcome to NYC Health and Hospitals Kings County YouTube podcast. Today, I'm introducing Stafford Faulkner, one of our addiction program administrators, to talk about some of the structure of our SUD services, resources, and protective factors for our patients. Our programs at Kings County we provide wraparound services, meaning that we treat the whole person. We are working with patients who have mental health and substance use disorder services co-occurring, and we want to provide individualized care. And in doing so, we treat people and their families, if they choose to address it with them, with all of the services that we provide: on-site primary care services, psychiatric services, psychotherapy, and drug and addiction counseling. So Stafford administrates one of our programs. Tell us about your process, how it works for you, and just walk us through a patient walking through the door.
Right. So the services that we provide for patients who are diagnosed with substance abuse, we would first screen them depending on their particular drug of choice and the services that we have tailored towards treating that particular drug of choice. We have a multidisciplinary team consisting of counselors, nurses, doctors, physicians, and even nutritionists. So patient comes in, they're screened for if it's opiate use, they're screened for opiate treatment, and they are engaged in the program.
One of the issues that come up, most of the patients have multiple drug use. So how do you treat the individual, the whole person, starting with all of the assessments at the beginning for trauma, suicide, and all of those opioid overdose crisis issues that are going on today?
So we have specific tools to screen patients who are basically using different substances. We have a CSSR to screen for trauma and suicide. So depending on which track the patient is coming from, if the patient is a walk-in patient, we have screening for walk-ins. If the patient is coming from another program or from another facility, then there's questions that we screen over the phone so we can know how to address the particular areas that the person needs to be addressed.
Some of our patients have a lot of complex issues: attendance, issues with continued drug use, struggling to manage and regulate their behaviors. What are some of the ways that your team treat those patients who are resistant?
We provide a service based on what we call our patient-centered care, right? Addressing the patient and treating the whole patient, but starting from where they would like to start from. Oftentimes, patients have these different hiccups regarding their denials, right? So we use a technique called MI, right? Motivational interviewing. Rolling with the resistance is part of the MI skills. So depending on where the patient is, we'll start from their comfort level.
How about those patients that are at risk for overdose? Could we wait for their comfort level, or do we have to employ some other resources that would really address the issues right away, because those are very important and very chronic crisis mode issues? How do you address those issues?
Absolutely. So with that level of, I would say, seriousness, we engage more so what we call our high-risk team. So we'll monitor that patient more vigorously. So we have a specific counselor that would monitor the patient's attendance day to day and report back to the team as far as how the patient is doing.
So that's a daily exercise in what happens. When the actual overdose happens, what happens after an overdose? How do you address the issue? What are some of the important factors to take into consideration?
Okay. So if an overdose actually happens, then we involve the entire team. So we will assign that patient not only a primary counselor, but also a counselor that monitors their attendance, involve the medical team, so we're keeping track of at-risk behaviors, or if we need to refer the patient over to the medical suite. And we also have our mobile crisis team to keep track or to engage, if necessary, if the patient is in distress, not answering their phone or attempts to reach the patient.
So that speaks to the wraparound nature of the service that is done. We reach the patient wherever they are, whether they're at home or whether they are in our service. So Narcan is what is used to reverse an overdose. Let's talk about the education that goes into that.
So Narcan, yes, Narcan is a medication to reverse the overdose. It is something that we provide training for all our patients. We do offer that training to patients' family who is involved in treatment. So it is a around the clock, or I would say, involving service that we offer.
And we talk about overdose and using of the Narcan kit. We make sure that every individual knows how to use it, the layperson on the street. We do public education to address that. But make no mistake, an overdose is a medical emergency and must be treated as such. 911 has to be called following the overdose, and this person has to be given emergency medical services. Our team of providers are excellent at what they do. They're experts in their field, and they are trained to address substance use in all its complexities. Thank you for joining us today, Stafford. This was really great information. It's going to help our public receive the resources and services that we provide and just know a place to go. Thank you.
Thank you for having me.